Hello. Happy New Year.
We made it back.
We made it, 2024. What's new with you? How have you started your year?
Well, made it through the holidays, first of all. Proud of me.
Accomplishment on its
Um,
own.
yeah, lots of traveling, stuff like that. To be honest, I just spent the last 30 to 40 minutes cleaning up explosive diarrhea in my house from
Oh
my
my
foster dog.
God.
Yeah, it smells as great as you'd think. But
Never
my floors
ends.
have never been cleaner. My floors have never been cleaner. So let's just look at the positive of this. You know what's funny? I have a thing. So this has happened twice now. You know about the other time too. Um, I think my dog gets like anxiety or like social jitters. So
Mhm.
this has happened she goes to a daycare local to where we live for socialization. And we had just been there last night for obedience training. So I don't know. Like, did dogs get IBS?
I was going to say, do you think she picks up a bug when she goes there?
That's a great question, but no, actually, I don't think so because how this works is we were all sequestered in corners. So the
Oh,
dogs really didn't have interaction with one another. Some of them were reactive, some of them are really timid, all from different
right.
scenarios. So I'm gonna go with no. Like it's not like they were like licking each other's butts or anything. So
I mean, it's good when they're not licking each other's butts, but
anyways, what about you?
crazy. Well, nothing really. I had my own bug last week.
Was it
I
from licking butts or did you avoid that?
Thankfully, I avoided
Yeah.
the butt licking, but it was the first time in my 6.5 year career that I actually left work like mid patients. Like I was like, gotta go,
Dying right now.
have a good one. I was out Thursday night. Friday, I sat on the couch all day. Now, knowing me, like I can't not do things. So I was like doing computer work, but I was like
But
doing
like
computer
dying on the
work.
couch.
Yeah, like dying on the couch, leaned back, hood up, computer work. And it wasn't good. Right now I just got back from Costco, and you know what? I thought everybody would be back at work, to be honest. So I was like, I'll go. It was a absolute zoo.
No
Chaos,
way. I was just gonna
chaos.
say I have to make a stop. Gonna
No,
avoid it.
don't do it.
Don't do it.
Chaos. And not to mention, everyone is miserable. Like
No.
I thought, you always think leading up to holidays, it's stressful, the
Right.
tension, the no, people
Well, what's your reason
miserable.
now?
Like
Oh,
everyone's like crashing into you or like just giving you a dirty instead of being like, excuse me.
sorry.
Everyone's just I'm the one saying sorry to everyone around me. Everyone around me, sorry, oops, sorry,
Well,
oops, oops.
Canadian fashion, if we have any American listeners.
Yeah. So it was too much. Like to the point where I was in
Mm.
line and my husband texted me and said, "Can you get mangoes?" And I was like, "No,
No, no,
no,
I can't. We will be
mangoes are gonna
mango-less this
stay."
week.
So yeah, that's that. I really want to get into it because I think we have some good
Yes.
topics today. We're going to start with talking about some wellness trends from 2023, and we're going to kind of move into 2024. And there's this trend on, mostly I've seen it TikTok, where you're talking, and Instagram
Yes.
Reels, where you're talking about like what's in and what's out. And I thought we could maybe put our spin
Yeah.
on what's in one and what's out for 2024. I have a list. We can comment, make some commentary. And
Yeah.
then lastly, for the agenda today in our Ask Reddit segment, we're going to talk a little bit about losing yourself in child rearing because it applies to both of us so much in our lives. And I thought we could have some things to say about it. So let's get into it. Wellness trends from 2023. Now, this, I just want to preface, these trends were outlined in an article, time.com. I don't know, is that like Time Magazine? Is that like the Time Magazine?
Yes, yes. And
Yeah, I
maybe
think
the
so.
yeah.
Anyways, time.com, they have wellness trends to ditch in 2023. So I thought it would be a good opportunity to kind of talk about some of these and give our spin on them because I wanted them to be relevant to kind of what we talk about here at Health and Her. So first thing is weight loss shots. What are your thoughts on the
Hate
weight
it.
loss
Hate
shots?
everything about it.
Hate it.
Um, yeah, it kind of goes in the same category as Ozempic. For me, is that a shot or is
Yeah.
that
Yep.
yeah, yeah.
Yep.
Hate
We're
it.
talking about Ozempic here, people.
Right, right. Yeah, hate it. It's highly, highly relevant in my practice. I have so many patients that are on it. And it's being marketed currently as this like miracle drug and as weight loss. And as Laura may or may not touch on, that was actually never the intent of the drug. It
Mhm.
so happened to be a secondary effect. And as per usual, I really, really dislike when, in just about any industry, when we're selling this like all in one solution, that magic pill, and we're not talking about, all of the fundamental habits that if we had those in the first place, we would never be on the Ozempic train, right?
Mhm.
So I don't love how it's being marketed, first of all. Now, that being said, I always try to take a step back. And I'm always getting the accounts of my patients from their medical interaction. So I always try to keep in mind, because I have heard my patients try to reiterate what I have told them in previous visits. And I was like, that is 100% not what I said. But it seems like we're not having a balanced discussion of benefits versus risks, what the drug is for, how long we should be on it for.
Yeah.
All of my patients are like, till I die, I'm on Ozempic. This is just life now. But obviously, for those that don't know, Dr. Laura and I, we pretty much make our living off of making true, simple health changes for long-lasting health results, right? So if we had all of those steps in place where we are actually addressing those lifestyle things like diet, like exercise, like stress management, things like that, this drug wouldn't be in existence. That's my general feeling so far.
Yeah, and I wanted to talk about a few specific articles that I pulled up because I think that's the whole thing is I always talk to my patients about tools and next steps and what now, right? And what's our expectation and what's our timeline, right? And so Ozempic or Wegovy or Saxenda, there's a lot of different brands. They are done a little bit differently, but I do know Ozempic is a once a week injection. And so that's advantageous to people, especially people who have diabetes, to only have to have their injection once a week as opposed to have to remember a pill every day or an injection every day. I get it. There are some concerns though, because I think with anything, when it's new and fancy and exciting, we don't have any long term data. And that's always going to be my argument with a new drug or treatment of any type. It's like, well, what's the long term look like? Because we don't know long term until we like take a step forward and then we look back and we say, oh, yeah, yikes.
Yeah, that happened.
Right. And so a couple of the things I wanted to highlight, and let's start with most recent. So January 4th, 2024, so this year, there's an article from The Hill. The FDA investigates reports of hair loss, suicidal thoughts in people using popular diabetes and weight loss drugs. And I'll just read a little bit. The FDA is looking into reports of adverse side effects from using diabetes medications such as Ozempic and Mounjaro, with hair loss, suicidal thoughts, and airway obstruction being among the reported complications. And so they receive reports of patients experiencing alopecia, which is hair loss, aspiration, so suicidal ideation, while taking the GLP-1 receptor agonist, which is the type of medication they are. Um, what did they say? They said Novo Nordisk, which is the exclusive patent holder for the drug, notes gastrointestinal issues such as nausea, diarrhea, and constipation are the most common side effects. And actually, those are the most common side effects that cause people to discontinue the drug because they can't
Yeah,
handle
I would
being so
say
nauseous.
some of the more common side effects that my patients deal with, a lot of reports of GI upset.
Yep. And according to the medication guide for Ozempic, other side effects can include pancreatitis, kidney failure, low blood sugar, and changes in vision. And so the current medication, documents don't contain the side effects like the suicidal ideation, the hair loss, and everything else that I've just mentioned. However, I feel like when we're looking at treatment, we have to look at a risk benefit analysis. And so if if I'm trying to lose weight, again, it's like how much weight. If I'm trying to lose 20 pounds, I won't take anything that's going to risk me getting pancreatitis or kidney
No,
failure. Maybe if I have to lose, a substantial amount of weight.
Yeah, if you're a bariatric patient, meaning
Yep.
you're over 500 pounds and we're no longer fitting through doorways
Yeah.
and popular modes of transportation, then absolutely, then that
Yeah.
that scale might slide a little bit.
Right. Not to laugh of it. It's not a funny, but I smile because it's crazy what I'm seeing it being prescribed for, right? It's being prescribed for someone saying, I just want to lose weight, and the doctor will write the prescription because it's seen as
And this
this.
being like a first, there's, honestly not all a discussion of what have you tried? Have you
Yeah.
been consistent with physical activity and, monitoring your diet, making these interventions? It's like kind of like we're just going here now.
Yeah. I also, and this is not something I've really seen in the research yet, which I think we probably will see in the future, but I'm also concerned because of the mechanism of action. One of the things it does is it slows gastric emptying, and that's one of the ways in which it reduces appetite. And
Right.
so I worry about the microbiome effects of that slowed gastric emptying. So again, that may only come to light in the very far future.
Yeah.
Um, another January 5th, 2024, which was just a few days ago.
Days ago.
News release from the National Institutes of Health actually found, because I had said it's being looked at for specific side effects, but I want to make sure we're speaking really accurately. Semaglutide associated with a lower risk of suicidal ideations compared with other treatments prescribed for obesity or type 2 diabetes. The NIH-funded analysis finds patients treated with semaglutide had 49% to 73% lower risk of suicidal ideation than those given other medications. My first question is,
What are the other medications too?
well, what are the other medications, and what are the people like overall? Are people on these medications having a higher risk of suicidal
I
ideation?
was just going to say, what is the baseline? Where are
Yeah.
these people sitting at mentally and emotionally before even going on the drug? That would have been interesting to know.
And to be honest, I didn't really go into the nitty-gritty of this specific article, but researchers examined electronic health records in the United States from about 240,000 patients who were obese or overweight. They were mostly women. The mean age was 50 years, and they were prescribed semaglutide between June 2021 and December 2022. In this group, 232,000 patients did not have a prior history of suicidal ideation. Almost 8,000 did. The researchers also replicated findings so they looked at 1.5 million patients with type 2 diabetes who were prescribed this medication, so much, much larger group. And what they did is I'm just trying to see if they looked at like what the baseline was. Okay. In patients with type 2 diabetes, semaglutide prescription was associated with a 0.13 risk of first-time suicidal ideation and 10% for recurrent, compared with 0.36 and 18% for other diabetes medications. So really, the thing we should be concluding here is if you need treatment for obesity or weight loss and you have a history of suicidal ideation,
It's going to bump it right up.
bump it right up. So you probably should not be considering this. And I don't think these are conversations that we're having.
I
So
don't think so either. I don't think anybody's asking this.
it is a little bit of a clickbaity situation here, this article saying that it's associated with a lower risk compared to other treatments. It's like when we're looking at risk benefit, okay, baseline. We have a person who has to lose or wants to lose weight, a person who has diabetes. Who needs to be treated more with this medication? Diabetes,
Yes.
right? And so then it's like, okay, so already we're putting ourselves at a step up one risk for the weight loss person because we didn't really truly need that right now, potentially, right? Could be a tool in the future, could be a short-term tool, but when we're making these considerations, we have to look at all of the things on the table. And then the second piece is, have you had a suicidal ideation before? Potentially, and we know the statistics. For example, someone who struggles with PCOS often struggles with weight loss, often struggles with anxiety and depression.
Yes.
So let's take a patient. I'm just throwing out examples here. Take a patient, can't lose weight because they have hormonal imbalances that have not been accurately or adequately addressed because PCOS 60 to 70% of the time has an insulin problem. And we try to treat it with birth control. So no wonder these people aren't
Right.
losing weight. It is a hormonal imbalance. It is not, I want to be clear, it is not their fault they can't lose weight, but we're going at it it's an insulin issue. This is
From a
why these,
totally wrong direction.
right, this is why these diabetes treatments work. So what I say to my patients who are trying to get pregnant, they have PCOS, they get put on metformin, diabetes drug. This is why it works, because you have an insulin problem. Now let's come back. We've been giving you birth control. You have suicidal ideation potentially in the past because PCOS comes with an increased risk of anxiety, depression, which we know comes with an increased risk of suicidal ideation. Let's just put that person there. Should we be going to a semaglutide? Who knows, right? But
We would want to heavily consider the risks.
potentially, right? Potentially. And this is just looking at it from all angles. So that's that on the suicidal ideations. We'll move on from it, but I just thought that was interesting. The next article is from a little bit in 2023, May, which talks about the misuse of Ozempic for rapid weight loss can cause significant and perhaps permanent hair loss. Now, women do not love to hear this.
That.
Yeah.
Don't sign me up for that. I think I'd rather be chunky.
Yep. And one of the reasons, I want to be clear, it's not the Ozempic itself that's causing the hair loss. Because some people say, well, Ozempic hasn't been shown to cause, it hasn't. No. But you know what does cause hair loss? Rapid weight loss, not getting enough protein, which people who are on Ozempic cannot get enough protein most times because they aren't hungry. Period.
So they don't want to eat it.
Period. And rapid weight loss can also mess with your thyroid. So
100%.
And again, it can be permanent hair loss. So again, a conversation we need to have about slow, steady, sustainable weight loss.
And proper dosing too, right?
Yeah.
Like,
Yeah. Yeah.
yeah.
And lastly, the last thing I'll say on Ozempic, because this is not an Ozempic podcast, we're just talking about one trend right now. But on CTV News, this was November 2023, so the end of the year. And there was a proposed class action lawsuit against Ozempic that alleges that they failed to disclose serious side effects. So we know that I've talked about gastro problems. Here's the article. Intense vomiting, painful gallstones, masses of food slowly forming forming a painful obstruction in the stomach. These are some of the side effects described by members of a proposed class action lawsuit, which alleges that the makers of Ozempic, a drug created to manage type 2 diabetes, but which has gained massive popularity as a weight loss tool, failed to adequately describe the potential side effects. One BC woman says the waves of gastrointestinal illness she suffered while on the drug could be debilitating at times. And this is quoted, if the drug company isn't letting the doctors or patients know that there's a risk to severe side effects like this, how on earth can we make an informed decision about a medication that we're going to put into our body? Again, we're looking at a totally different set of risks if we are treating diabetes, which has serious life-threatening complications, and being overweight. Now, overweight to a degree, right? We're talking, if you have 30 pounds to lose, we have a different risk profile than if you have 350 pounds to lose, right? And we have to consider these things when we're making decisions. I think a lot of people have been made, and celebrities glorifying it as like the skinny shot.
Yeah.
It's not the energy that I want this year.
Nope, we're leaving it behind.
We are going to leave it behind. Next trend is diagnosing yourself on TikTok. I don't have notes on this, but like, what are your thoughts?
Oh, well, for those that know me, probably know that I'm not on TikTok, but I'm gonna extrapolate this to mean social media in general. And I'm not a fan. I'm not a fan at all. Probably because I have some skin in this game in that, you know, I went to school for 8 years to receive a doctorate to be able to diagnose and exclude other conditions, right?
Yeah.
So Dr. Laura and I have talked about this all the time, that debatably, one of the most valuable things we can do for our patients is, rule out a set of conditions that they may not be dealing with, right?
Yep.
Just to rule out other causes for things. And I don't know. Again, I'm not on TikToks. I don't know how many did I say it wrong? Is it TikTok?
No, do you. Do you, Granny.
But, I don't know how many of these people are qualified healthcare professionals and professionals in their own arena. But again, when it's influencers, talking about trendy things, oftentimes it ends up being really dangerous because it's so viewable by people. Like in my world, I'm working with I primarily work with the perinatal population, meaning pregnancy, postpartum. In the postpartum period, we are dealing with a lot of different things, which I'm sure we're going to talk about in other episodes, but bodies rapidly changing, roles within the family rapidly changing, and our careers are shifting. There's so much at play here. And a lot of us kind of grieve our previous bodies, previous abilities, and things like that. We see these little influencers talking about, the best core exercises and the best is for your pelvic floor and blah, blah, blah. And then they come in to see me, and I find that actually what they've been doing and the information they have received is now exacerbating their condition, right? And I'm having to break it down and actually say, well, TikToker Janine, I'm really struggling with TikTok. Yeah, it's not giving you the correct information, right? And I have to kind of break things down to bare bones. So,
The
yeah, hate it.
the other thing is it's an interesting phenomenon because I really believe in having educated consumers, and I'm all
Mhm.
about I think actually I just posted a TikTok video today, and it's interesting because I feel like my comments on TikTok go one of two ways. One way they're saying, you're not a real doctor, yet like that energy. And then
Right.
the interesting type of comment that I've seen the other way recently has been, "Oh, are we actually even trusting doctors anymore?" Like I was like, "Oh,
Oh,
now I'm a doctor?" Oh. But
wow.
so it's
You
interesting
wear so
because
many hats.
I wear so many hats. Sometimes I'm not a doctor, sometimes I'm a doctor, sometimes, sometimes I'm a wannabe doctor. The point
Right.
is, I think I really, really value having educated consumers. I really want people to understand the information that they're seeing. And
Information on there is bad. Like and
no,
probably you do too, we follow other people in this
totally.
arena that are doing fantastic trailblazing things and really great at breaking down complicated medical issues to digestible lifestyle changes, right? So in that way, you're right. It can be valuable.
And
And now I'm on the fence.
Well, and I think, but I think over, especially since the pandemic and the changes in healthcare, and we are in Ontario, Canada, and the healthcare system here is mediocre at best. People are
That's
waiting for
fair.
specialists, people are waiting in emergency rooms, people are not getting their children seen, and people have lost faith in the medical system. They've lost trust in the medical system. And so I don't agree with people diagnosing themselves on TikTok, but I think people feel like they have no choice. And the people that see you and I, because we are doctors, but we are a unique breed of doctors because we are the alternative. So sometimes people see me and they're like, if you tell me right now that I have to go take this medication, I will stop seeing you right away. Like if I have to go to my doctor and get a blood pressure medication, or if I have to go, I will stop working with you because they have lost so much faith in the conventional medical system. I find that I'm often trying to be like a mediator between
Right.
both because I'm like, listen, it's not all bad. Like there's things that you need and there's things that we need to use, but like let's reel it back in. And I think that as healthcare professionals, we could all do a little bit better just, bringing that trust back to patients so that they aren't flying off the handle and going to see Joe Blow online. I've had a patient and I've spoken about it before, not in this capacity, so I'll mention it now, but I've had a patient who I was working with. We were, like going through the motions, doing the things, and she wasn't getting the immediate results that she thought that she should get, even though we'd had multiple conversations about that's not how that this works.
Yeah.
She, anyways, drops off the face of the planet for a few months, hadn't heard from her. We were supposed to follow up, gone. I was like, okay, I guess she's, that's fine. She's working with someone else. Comes
Right.
back. I come to learn that she had taken a break from treatment with me because she found this Instagram person who was offering this cure. Do you want to know? Do you want to know the spoiler alert? It was
I
not a cure,
do.
in fact. The difference between myself and this person is I'm actually qualified to treat what she was trying to get treated. And number two, I'm regulated. So I cannot tell in the Instagram world that I'm offering a cure and this person can. That's the difference, right? A regulated provider can't promise you the world or give you a supplement plan for $1,000 and call it a day. right?
Right.
This person did that. She got no results, saw no change. We were back at square one, her and I, working together. Because
Doing the hard work.
she's like, listen, I'm back. Like, I realized. But here's the thing. I think people get duped. And so I think there's one thing in educating yourself and being an informed consumer, and it's a whole other ball game when we're in the weeds of social media. And that's one of the reasons why we wanted to create this podcast, because we wanted it to be an easy way to say what's real and what's not. Like, how do I decipher the truth?
And to blend the trends and the things that people are talking about on Reddit and social media, and what are the factual components of that, and what is potentially lies or not the full truth.
Yeah. And yeah, on that note, are we going to leave overdiagnosing yourself on TikTok in 2023? Probably, but I think we need to bring into 2024 being a really informed consumer of online content.
Yeah, I would agree with that.
Okay, next up from 2023, overdoing melatonin. I don't know why this article put this in here, but I have a little bit of a bone to pick with Time magazine.
In general, just
talking about melatonin in a derogatory light.
I thought we were just like starting a war just cuz. Okay.
No,
melatonin.
yeah, no, maybe I will over this melatonin problem. So let me just read. I just want to read what they have here on melatonin, because to put my beloved melatonin in such a negative light.
It's another marriage.
Okay, let's listen. So, Americans are getting less sleep than they did before the pandemic. Perhaps as a result, melatonin use has steadily increased, and now doctors say we might be relying too heavily on the over-the-counter sleep aid. Now, they're saying lack of data, no regulations, blah, 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 blah. But research published in 2022 indicates that melatonin overdoses among kids increased by 530% from January 2012 to December 2021, escalating during the pandemic. The American Academy of Sleep Medicine issued a health advisory imploring patients to talk to their doctor before giving kids melatonin. So that
children is
the problem. Yes.
Okay.
So people were trying to make their kids pass out because they were over them during the pandemic.
And you know what? I'm not going to judge. I'm not here to judge.
Here's the thing.
Here to say it's probably not a good idea.
Melatonin has so many benefits. So many benefits. Everything from, and we could do a whole episode on melatonin. We're not going to talk about it in depth right now, but everything from egg quality and fertility. It gets rid of free radicals. It's a wonderful antioxidant. It is a great sleep aid, and we know the importance of circadian rhythm and how it truly impacts your health in general. It's not just about falling asleep. It's so much more. It's antiviral. There's lots of research on, viral infections and everything else. But, if you had spoken to me and said, hi, Laura, lover of melatonin, uses melatonin herself, used melatonin, throughout the lifetime, would you give it to your children, and would you recommend I give it to mine? My answer would be No. No. Don't give your children melatonin. And this is where we come back to educating ourselves on TikTok. There are, in fact, lots of herbs. Oh, and did I mention melatonin is mostly safe and cheap? Just as a
very
side note.
Cheap, actually.
But
also a lover of melatonin and use it regularly.
Yeah. No, it's wonderful. And
now I don't drug my kid with it either, in case anybody's listening.
No, and here's the deal. There's so many herbs that can be used for kids safely and effectively. There are so many things that can be used in kids. But this comes back, I think, to the TikTok conversation. We have to do things safely. That's it. We have to do things safely. So really, again, a little bit clickbaity. Had to do with children. People are giving it to their kids and they shouldn't be. And did you know, if you are on any sort of mood meds, specifically SSRIs and SNRIs, you should not be taking melatonin. It can increase the risk of serotonin syndrome. So, fun fact. Okay, let's shift gears a little bit to the last point, and potentially we'll see. The last point that Time talks about is toxic body positivity.
So much to say.
For something to be out in 2023. So let me just give a recap here, okay? The body positivity movement aims to accept, appreciate, and celebrate all bodies, regardless of size, shape, or ability. But increasingly, critics say the push for body positivity has turned toxic. It places the burden on those who are more marginalized. I can't speak. It places the burden on those with more marginalized bodies to simply love themselves, irrespective of the very real systemic forces that promote negative body image. I don't really understand. What are they trying to
I
say?
don't really understand that statement, but
No.
I think what they're saying is we've swung pretty far the other way.
Yeah. I think you and I have a different thought than what Time magazine is blabbering on about. But
Right.
I just want to, before we get into this topic, because I think I know the things that you're going to say, and
Probably.
or potentially, and I just want to preface with, don't hear what we are not saying, right? We need to make sure that when it comes to body positivity, for me, I think the health conversation comes to my mind.
Mhm.
But I also think it also doesn't mean that you have to hate yourself if you are at a certain,
Agreed.
right?
Agreed.
Like, don't hear what we're not saying. We are not saying that, you can't be beautiful, but we do have to understand the health implications of weight
Correct.
and
Yes.
BMI. But you don't hate yourself all the way through
We
it.
want you to love yourself
Right.
along this journey, but we
Right.
want you to be driving the ship towards
And
health.
I said this to Dr. Ashley about myself. So I personally, since having kids, have gained 30 pounds. I need to lose 30 pounds. I am not at I am not at a healthy BMI right now. I'm not. Straight up, I'm not. Now, am I morbidly obese? No, but I'm certainly overweight. And that's fine. I don't hate myself, but I'm actively working towards
Correct.
not that. I'm
And
not trying
that's
to like love myself here and stay here. I am
correct.
loving yourself can be a whole part of, anyways. You go on with what you were saying, but I just wanted to preface that.
Yeah, no, I think that's so important, and something that I have actually actively made a point that I want to talk about. I feel like I'm like the negative Nancy today. I'm like, I hate this. Which is true. I don't like this either. Straight up, Dr. Laura and I, or she chatted about this a little bit earlier in the podcast, but straight up, when we were talking about Ozempic, obesity and physical inactivity are independently linked to various conditions and overall poor health outcomes.
Yep.
Meaning that alone, regardless of your health habits, you could be eating well. Unfortunately, if you are obese, that is an independent risk for a slew of other conditions, right?
Yep.
Cardiovascular disease, certain types of cancer, list goes on and on, okay? So is physical inactivity,
Yep.
right? And we're going to circle back to why that matters. So it is, in my opinion, kind of like Dr. Laura said, there's an in between. I don't think it's okay or good to be morbidly obese and just be like okay with it and just loving your body as it is with no intentions of changing that,
Yep.
right? From a health perspective, okay? I really feel like we've swung really far the other way.
Really far.
Really, really far.
To
And
the point, can I just interrupt? To the point
yeah.
where going back on TikTok, I see videos, and again, we don't want to, shame people for being a certain
No.
weight, but people are not listening to their doctors saying, I'm an overweight person, so whatever my doctor tells me, I'm not listening because they're just looking at my weight. There are instances where that is the case, but
Right.
we have to like listen
You have to acknowledge
yes.
where you're at, right?
Yeah.
And I also, from like the more positive end of things, I think this can go both ways, right? Like I said, physical inactivity is an independent risk factor. So something I will do, and oftentimes it comes through the whisperings. Again, particularly when I'm working with the postpartum population, we'll talk about whether you're working with me in a program or one-to-one, we'll talk about goals, and a lot of people will spout out some really functional goals of, I really want to get back to strength training safely. Okay, amazing. And then almost every time near the end, they'll whisper, and I'd like to lose weight.
Yeah.
And I'm like, that's allowed,
Yeah.
right?
Yeah.
We are allowed to acknowledge that we want to lose weight and feel good in our body and our clothes. That's okay. I
Yeah.
want you to speak that and work towards that. Um, I want to stop making people feel weird about their weight goals when the outcome and the process to get there is actually very, very good for them. And circling back, I'm all over the place on this one because I'm so passionate about it. Deal with it every day.
Yeah.
So even if I have a patient that's, whispering their weight loss goals to me and they are obese, right? And they're saying, I actually really enjoy physical activity. Like I have this walking group or I started this, swim class, and I'll say, Kay, this is amazing because even though you are overweight, obese, you becoming physically active is actually such an important component and is going to help with mitigating a lot of those risks as well, right? So you can be obese and be working towards your health and loving yourself. It can all
Yes.
exist. It can
Yes.
all exist.
Yeah. And I think that's a huge thing because that's what we're missing. It's like and people got what's her name? Oh my gosh. Why is her name slip my mind? Big singer. Curvy. What's her name? Oh my
Lizzo?
Yes.
Yes, we did
What is
it.
what is wrong with me? People gave Lizzo flack when she lost weight because
And you're
she
like,
was supposed to
why?
represent the big bodies, and but it's okay to work towards health and love yourself through it, right? Like I'll tell you for free that I didn't love myself at 120 pounds, and that's a whole different problem, right?
Right,
So this is what we're not talking about. We're not saying you are overweight, so you're not valuable. No, 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 right?
right.
But we have to understand that being obese is a health risk factor. And I think a lot of doctors tiptoe over this subject because they don't want to be, a
I
fat
mean,
shaming or
right.
whatever. And the other thing I want you to bust a little bit, the myth is that BMI is not real.
Oh no, BMI is real. Now, here's again, talk about things that coexist, okay?
Hmm.
BMI has flaws. Let's
Yes.
acknowledge that. There is certain subsects of the population where it is not as accurate, not as relevant. And this is more common in my arena, and that's bodybuilders. So these are individuals, men and women, that are training in such a way that they have very significant muscle mass, right? And ideally trying to have less and less fat,
Yep.
right? So, what people may or may not recognize is that lean muscle mass is very dense tissue. It's actually quite heavy, far more so than adipose tissue or fat, right? So when you have these individuals that have, massive muscle bulk, right? And are large people, right? They are not easily represented in this scenario. But let's look around. Let's look at the
Yeah.
population. How
Yeah.
many of y'all are bodybuilders,
Right.
right?
Right.
For the standard individual, the majority of people that we treat and walking around this earth, it is actually a very, what I like about it is it's very simple,
Yeah.
right? Very simple to calculate, very simple to remeasure, and for the individual to kind of keep track of, right? But really it's a factor of, your body weight to your height, right? Um, and oftentimes also indicates for a lot of people where they're carrying their weight, right?
Yep.
And I think that for the majority of people, it's actually a very reasonable health measure.
And again, reasonable along with
Right.
everything else. And I like to do waist hip ratio in women. And so
I
again,
really like to
if
do
you're
that too.
off with the BMI, what's your waist hip ratio, right?
Yeah,
If it's 0.8 and your BMI is a little bit over, you're actually looking pretty good, right?
pretty good.
And so we need to look at a bunch of factors, but I think toxic positivity's got to be body positivity toxic in a toxic way has got to go.
Right.
It's got to
Yeah.
go.
I think more and more people are acknowledging this. And again, I'm not going to call out any people individually, But, Laura and I have shared in our community, there's a couple of people that are really, popular in the social media realm. And I just wish more people would kind of acknowledge, almost like the Lizzo thing. It was like, I saw the same individuals preaching like, I love my curves. I've gained so much weight over the last couple of years. I'm big, I'm proud, and stuff like that. And really that toxic body positivity on that end, to now sharing, here are my lunches,
Yeah.
low carb this, low carb that, 2024 goals. And I applaud them for
Hmm.
making goals for themselves. But
Hmm.
I think it's interesting to kind of watch how, quickly somebody will flip it. I'll often say, I wonder how happy they really are in their own skin. Or if
Yeah.
that's just something that we're portraying, right? And then what I'm seeing over and over again is, quite, it might take a month, it might take a year, but eventually I start to see, posts and talks about getting my health in check. And I'm like, aha, there it is.
Yeah, because it is about getting your health in check. And again, it's okay. You go through depression, you have a baby, you become a mom, you're
You're doing the
lacking
best that you
sleep.
can in that
You
given moment,
Yeah, and
right?
like I said, I gained 30 pounds, but I'm not here saying I'm like super pumped and in the best place I could ever be with this
Right.
gained weight. I'm saying, I could lose it, and I'm every day I'm taking
And
initiatives.
I'm making those steps.
Yeah, and every day, and sometimes I have setbacks. And sometimes I do really well and some days I don't. And it's a journey. But I think just acknowledging where you're at and just really giving yourself respect for that. Again, if you went through a divorce or you had another trauma, lost a parent, or anything else, right? Your body's there to kind of, serve you in that way, and it does a wonderful job of doing so. But
Yeah.
I don't think we need to promote people to, be morbidly obese, right?
No, no, I won't
Yeah.
be.
Yeah. So I think that topic might have been sticky, but let's get into something else. So, what's in and what's out? I have a few things I want to list. So for me, again, some of these might overlap with some things we've already talked about, so it might be a little bit quicker. What's in? So for me, it's always going to be simple health fixes, getting to the root cause. I think that goes without saying. That's kind of what both of us are about. So
Yeah, for sure.
that's what's in. For me, what's out is doing everything that Joe Rogan does. Let me explain a little bit more. Because you know what I love Joe Rogan. I'm like,
Yeah.
love it. I think he's interesting. Here's the thing though. He is an athlete who has been doing what he does for years and years and years. And so people, when they train and they get to a place where they've kind of done a bunch of stuff, they're now at the tweaking phase. They're at health optimization. What else
Setting
can I do?
foundation, right?
Yeah. They're like, how can I level up? Like, I'm gonna get a cold plunge in my house and I'm gonna do this hydrotherapy in my, all the things. I'm gonna
Yeah.
take this crazy mushroom supplement and I'm gonna do, all the things, right? And so I think that the things he talks about are certainly cool. A product to level up mitochondrial function or something else. But a product like that is not going to be what someone who's insulin resistant, doesn't eat well,
Appropriate for where
doesn't
they're at.
exercise. Right. You have to start with where you're at. So I want you to ditch the fancy fixes, the happy juice, the expensive stuff,
You're waiting for that.
and I want you to focus on the simple things that you can do every single day. Do you have any thoughts on that?
Yeah, actually, it's funny because one of the things that I had written on and mine, and it goes right into that, is imperfect exercise versus super structured, regimented protocols that no longer fit in your life, right? Because again, it needs to be a daily, attainable thing that you could do, right? So a lot of the individuals and the women I work with are like, I used to belong to a CrossFit gym and I want to go to the 7 a.m. workouts, 3 times a week. And from there, and then they get really disappointed, right? When they're like, oh, I just remembered that I have 3 kids and showing up at this specific day and time doesn't work for me. And they're unable to meet their goal. And therefore they get, super discouraged that way, right? And kind of along that train as well. Actually, a lot of mine kind of flow off of what Dr. Laura said. So I'm just going to take over for a sec. But another big one for me is adequate calories versus low carb, right? I'm over the low carb movement. I have been pretty much since it started. Again, for the majority of the population, right? Some people can really benefit from a lower carbohydrate diet. For the majority of us, carbohydrates are the body's preferred source for energy, right? So I have all these women that are saying, like, I'm going to be on this low carb diet. And I'm like, why? Genuinely, I'm trying to tease that out. Like, why must you be on a low carb diet? Well, I need to lose weight. And I'll be like, okay, are you exercising? Yes, I am. What are your energy levels like? Well, they're dog poop. I'm not sleeping very well. I don't have the energy to put towards my workouts and things like that. And so I'll often counsel them that, carbs are not the devil. They're not, right? So I would like to see a shift between, having like adequate calories. The amount of women that I work with that are like, I eat 1,200 calories a day. And again, I'm like, why? Why do you eat 1,200 calories a day? When I look at my Fitbit, by like noon, I've burned. Now, I'm sure this is not entirely accurate, but I'm like, I've already burned 1,200 calories. Like,
Yeah.
you don't have the energy to life
Yep.
at
And
1,200 calories. So that one's out for me.
I appreciate you holding the fort down. I had a phone call come in I had to get. If you're watching on video and you saw me on the phone, my car had to go to the mechanic this morning because of real life, and I have a $1,100 bill that I gotta go deal with
Cute.
later today.
Love that for you.
Love it for me too. No, my car has been making like a weird noise, and it's like this typical
Life.
woman calling about their car making a weird.
Right. Did you do the noise for them? I always do that.
It goes.
I was like, you're welcome for your entertainment for the day.
So anyways, he called me before at the beginning of the podcast. I was going to call him back, but he called me again, and I'm like, ooh, it's bad. So I had to answer.
It could be bad.
So
I just assumed it was like a school call thing. And then I think the last one for me, because now that I'm like shifting through my monologue here, a personal one for me, I've talked a lot about what I would like to see in the universe. And the patients and the people in which I work with. But this is something that I would like to do and then project onto the people I work with is stop comparing myself to other people in my industry who are childless and have better support systems than
mic drop
versus the compare game, right?
Yeah.
That's gotta go.
Yeah.
We're all on our own journey and have different support systems, right? So single / co-parenting mom who works the hours I do is not going to do the same thing. I don't have the same 24 hours as other people do. And in fact, most of us don't have the same 24 hours in a day. So let's stop playing that.
And on that note, I always see things being like, you have the same 24 hours in a day as Beyonce. You literally do not.
Literally do not.
You don't.
Literally don't.
Because Beyonce has nannies and housekeepers and drivers and
trainers that come to her house.
Come on. We do not have so don't feel bad that you have the same 24 hours as Beyonce. I'm over that. Things that I want to add in, sleep. Don't get up early to exercise if you're not sleeping properly. Sleep like it's your full-time job. Period.
Or scale the movement. So here's a very example. Here's a very good example. I know she's like, I'm called out. Yeah. No. Okay, so I messaged Laura this morning. Laura and I talk like all day long, by the way. And I had a very poor night's sleep last night, getting to about just under 5 hours, right? So not a great night's sleep for me at all. Was today the day to go balls to the wall in the gym and do the hardest workout I could? Absolutely not. Nope. I don't have the reserve for that. But could I potentially go for 2 20-minute walks to take my diarrhea dog around the block? Yeah.
Diarrhea dog.
I can do that, right? So shift it with where you're at with sleep too.
Yeah, I agree. And I think the last thing I want to put in for my what's in and what's out is investing in your health as priority number 1. and what's out is being bamboozled by unqualified people selling products
Love it.
online. Because
Love it.
if you can spend the money on those products, if you could find the money to spend there, you can spend them seeing a qualified practitioner to actually get you a plan that works. And I promise you, it is different. It is.
Promise you, you're never going to be disappointed in the money that you invest in your health.
Never. Never.
Never.
And I guess I can close this section off before we ask Reddit. Health community for support rather than health community for advice. Yeah, I think it's so important when you find your people, you find your community. But when we're on some certain mom groups, I'm like, ooh, let's not give advice here.
Yes on that. Don't do it.
Don't do it. I'll just tell you for free that if you're on one of those groups and you get advice, just know it cannot be a qualified healthcare provider because they are not allowed to do that.
We're not allowed to. We're not allowed to.
Okay, moving on to something a little bit more, serious. Losing yourself in child rearing. So this is Ask Reddit. I thought this was really interesting when I came across it. So let me just read it. Now that this is kind of funny, but now that my kids are almost cooked, I'm starting to feel useless. I'm realizing that I threw most of my energy into raising and enriching children and have done very little for myself. I don't really respect my accomplishments or know who I am anymore. I was a professor of child psych, then a stay-at-home mom for a while. I've been away from my career long enough that I don't identify with teaching. My partner makes enough money, so I don't need to work, although it would be helpful to contribute since we are starting college tuition. Is it typical to feel aimless and depressed at midlife? Have any of you reinvented your lives when your kids got older? My research was actually social justice and education, so I understand the monumental challenges that face many mothers and families. But when one is living this flat, unengaging life, it's still hella hard. I'm feeling like life is a chore. So it's tough, and I think we can relate at different stages of this journey. It sounds like she is at the stage where she already raised her kids and she's feeling a little bit empty nester. Feels like, she did her job and now it's like, well, I can't go into the workforce. I've been out too long. I don't really need to go
aside the professional grind, right? Like
Yeah.
that was not the priority at the time, and that's understandable.
Yeah. For me, I think I really resonated with this from a perspective of like I've lost myself in raising two little kids under 4. I saw a post on Instagram the other day and someone wrote, my therapist asked me who I was and I couldn't mention my profession or my children. And I thought to myself, I don't know how I would answer that. I don't know how I would answer that. I don't think I'm alone being a woman.
No, gosh, no.
In my 30s. I have no hobbies. I think that I've always been a person that's like, what do I like to do? I'm not, you have, and again, I know this about you, that you are very athletically inclined and you like to play sports and that's fun and that's a hobby. And I've never liked to do that. Now I exercise as part of myself, but I wouldn't call that a hobby. Would you call that a hobby? I don't knit. I don't read. And I'm just thinking, well, I feel like I used to be fun and, my husband and I would go out and do things and maybe that would be more of a hobby situation. And since having children, I cannot answer that question.
Ooh, that's yeah. I mean, and that's fair, and you're not alone, and you're right. From a very, very young age, I have played a couple of sports at quite a high level, and although I've taken a backseat to the competitive nature of things, I would also say an aspect of my personality is that I try. You know what? Maybe this would flip to some advice to you or anybody else, is that I've tried a lot of different things as like, you get curious about things, and I'm the kind of person that's like, I'm going to dive into this. Like randomly last year, I saw this, beautiful piece of furniture at the side of a road. I'm actually somebody who's like a bit of a garbage picker. Fun fact. I like got my son a sandbox that way, and I saw this beautiful little chest, and I picked it up and carried it home
You would.
and just casually.
Yeah.
And I was like, I'm gonna refinish this. Now, have I ever done any woodworking or finished a piece of furniture in my life? No. But could I learn? Could I mess it up and learn from that and just like do it again? Because you can, strip wood multiple times. Yes. And same thing. By the way, fun fact. So I teach strength training to women occupationally. It's a leg of my business. But I am 34 years old and I started that sport at like 29. Okay. So I randomly found myself, I wandered into a CrossFit gym in the town that
You would have wandered in.
yes. So there was a sign outside
Stop.
saying that they makes coffee and lattes. And where I was driving from, the only thing that I knew to be close was Tim Hortons. And I was like, I hate Tim Hortons coffee.
Yeah.
I'm sorry. That's such an un-Canadian thing of me to say.
Yeah.
Hate it. Don't love it. And I was like, this is great. I've been looking for good coffee. So I pull in and I walk in and there's all these beautiful, sweaty men, shirtless, jumping up on a block. And I was like, hey. But then I was also like really confused. Like, I don't think this is where the coffee is. And luckily, the gym owner is such a nice man. And he was like, oh, hey, can I help you? And I was like, I saw the sign for coffee. Like, I'm here for coffee. He's like, oh, we do that too. And he makes as he's making me a latte, I'm like looking around at the beautiful sweaty men. And I was like, where am I, by the way? Like, what is this? And he explained, oh, this is a CrossFit gym. This is, what we do here, blah, blah, blah. So I went in for a latte and I signed up for CrossFit at, 28, 29 years old. And that was my introduction to Olympic weightlifting. So at the end of the day, sometimes you don't know what your hobby is and you just try something.
Yeah.
And sometimes it sticks and sometimes it doesn't, right?
I know.
But what I was going to say from my perspective, where I kind of really lost myself is I joke because, I don't know, probably a coping mechanism, but I had some literal blackout years where I returned to work at 11 weeks postpartum with my son.
Yeah.
Still bleeding. I had a very tumultuous, traumatic birth.
Yeah.
And I had to financially, I had massive student loans. So I returned to work really quite early. And I was not sleeping through the night. And I was working with patients in a professional capacity. And I only started feeling like myself maybe 2 years ago. I have a 5-year-old in March, by the way. But for a long time, it was just this weird grind. So on the flip end of this individual that wrote in with her experience, I instead ended up taking on that professional grind while having a little tiny human. And that is also a pretty quick way to lose yourself too.
Yeah, and I think like for me last year, and I was the same way. So again, Leo and Bennett were born the same year, but Leo's November, so he just turned 4. But last year I pulled both of my kids, or not I guess for 2023, I pulled both of my kids out of daycare because I couldn't work because they were sick all the time. I had to hire a nanny who had limited hours. And so I was literally momming from morning till night, working smack dab in the middle. At the times I wasn't working, I was either booking it, driving from clinic, to clinic to home. And that's why I haven't been able to show up like in my marketing and doing things like this and everything else, is because I got so sucked into it. So I think in conclusion, 2024, my goal is to do something new. And that's something that everybody listening and Ashley can hold me accountable to.
Right. And kind of same, which is how I ended up on a podcast when I don't have TikTok or barely know what it is. So here we are.
Excellent. Well, I hope you guys enjoyed the episode, and we'll
chat soon.
Talk to you later. Bye.